This is Selma Schimmel for the Group Room at the 14th World Conference on Lung Cancer, WCLC, organized by the IASLC, the International Association for the Study of Lung Cancer. We are in Amsterdam. And I'm joined now by the Executive Director of IASLC, Dr. Paul Bunn, Professor of Medical Oncology at the University of Colorado in Denver. Hello, Dr. Bunn.
Good afternoon, Selma.
Dr. Bunn, I've been saving one story just for you, and that's the screening and diagnostic story involving low-dose spiral CT and versus X-ray. Let's begin by explaining there's different types of CT scans.
In a standard chest X-ray, the X-ray equipment is in front of you and sends out X-rays, and they go through you from front to back. And that gives you a two-dimensional view, but a two-dimensional view only. So, for example, if there's a tumor behind your heart, what you'll see on the chest X-rays is the heart, and you won't see the tumor behind the heart. Now, in a standard CT scan, the scanner is going around you at a slow rate, and it may take 5 minutes to collect all the information. Well, during that period of time, you're breathing. And so your diaphragms are going up and down. So if there's a small nodule in your lung, the nodule is going up and down. And so there are software programs to try to reduce motion artifact. Okay, but you're also, as that scanner's going around you, getting a lot of radiation. Okay, so in a spiral CT scan, the whole scan is done in one breath hold. So your diaphragm doesn't move. Mm-hmm. So small nodules that might be detected when the CT program eliminates motion artifact, it may eliminate the small nodule as well. And so you can find small nodules much better. In a spiral CT scan, you get much less radiation. In addition, in a standard CT scan, you have a dye that you have to ingest orally and that you inject intravenously, and that can damage your kidney and cause other side effects. So a low-dose spiral CT scan is way safer, and it's actually better for detecting small nodules compared to a standard CT scan.
This story has been all over the news. I don't know what happens now with patients calling up their doctors saying, you know, I have a smoking history, I'd like to have a spiral CT scan. How do you see this playing out with the public, and what does the public need to know? Because it takes time for standards of care to change and the way medicine practices. I mean, there is a cycle of natural activity.
So the study included patients ages 55 to 74 who had more than 30 years of pack years of smoking. That would be 1 package a day for 30 years or 2 packages a day for 15 years. Those are high-risk patients. We know those subjects are at high risk for developing lung cancer. And we know that they benefited. And then the question becomes, would people with a lower risk also benefit? So if you smoked 5 pack years, would a spiral CT scan benefit you? And the answer to that, since it hasn't been studied, is we don't know. Okay, so is there any reason why you wouldn't? Well, of course there is. One of the issues about the study is that 96% of the positive studies, positive meaning there was a nodule, the patient did not end up having lung cancer. And so there's all the worry and the expense and the problems associated with working up a nodule to find out whether it's cancer or not. So there is the potential for harm, and so if the benefit is teeny in a lower risk group and the potential for harm is just as much, it might not be beneficial. So at the present time, any recommendation that anyone will make will be similar to the trial entry criteria, namely someone 55 years of age or older who smoked 30 pack years or more. In the future, there will be studies that look at other patients with a little lower risk. And of course, we still need to know and develop tests that will be useful for never smokers who are also at risk for lung cancer.
So we're speaking in terms of screening.
Correct.
That's different than as a diagnostic tool.
Correct. If in fact you are working up somebody who has symptoms, cough, shortness of breath, coughing up blood, chest pain, or somebody who has a nodule on a spiral CT scan, the first step is to do a diagnostic CT scan. And that involves the intravenous contrast administration, a longer time to scanning, and so on. Sometimes a PET scan would be indicated, and sometimes a biopsy of the nodule would be indicated. And what the statement of the IASLC is saying is, if you do fit the criteria of this risk, you don't just go to anybody, because anybody might do the wrong scan, and somebody may not work up these nodules that are likely not to be cancer in the wrong way, and anybody might scare the heck out of you because most of these nodules are in fact not cancer. So not only do you have to decide with your doctor whether to have one, but you need to decide with your doctor who's the expert that's going to evaluate the CT once it's done.
Thank you, Dr. Paul Bunn, Executive Director of the International Association for the Study of Lung Cancer, IASLC, for organizing the 14th World Conference on Lung Cancer, WCLC, which takes place every 2 years. I know 2 years from now we will be reconvening in
Sydney, Australia, and after that Denver, and after that Vienna, Austria.
Thank you for inviting the group room to be here to help you in your communication efforts for patients, for your really humanistic, the nature of just how you are, and congratulations on a really fabulous meeting. I hope as it comes to an end that you feel really good about your accomplishments here in Amsterdam.
The largest meeting on lung cancer ever held.
Congratulations again.
Thank you.